All right, in this explainer, we are diving deep and taking a look under the hood at the silent, powerful system that runs your body's most critical functions, all without you ever having to think about it. We're talking about the autonomic nervous system. I mean, have you ever really stopped to think about it? Right now, your heart is beating, you're breathing in and out, your lunch is digesting. Who's doing all that work? You're not consciously controlling it. So what is?
So here's our game plan. We're going to explore the body's autopilot, then break down its two opposing systems. After that, we'll see how medicine has actually learned to hack them both with specific drugs. And finally, we'll wrap up by looking at what this amazing balancing act really means for all of us.
Well, that autopilot is the autonomic nervous system, or the ANS for short. You can think of it as the master controller, this hidden command center that regulates pretty much all the involuntary stuff that keeps you alive and kicking, everything from your pupils dilating in the dark to your blood pressure. The ANS is basically a constant tug of war between two opposing forces. On one side of the rope, you have the parasympathetic division. Just think rest and digest. This is your calm-down system. And pulling on the other side is the sympathetic division. That's your famous fight-or-flight system, the one that revs you up for action. Your body is always trying to balance these two to keep things stable.
So how does this whole thing work? Well, it's basically a chemical messaging system, and it's super elegant. Nerves release these little messenger molecules. You've probably heard of the big ones, acetylcholine and norepinephrine. These messengers are like tiny keys that float around until they find the one perfect lock, a receptor, on an organ. And when that key slides into the lock, boom, an action is triggered. It's that simple, and it's happening billions of times a second inside you right now.
Okay, so now that we've got the basics down, here's where things get really fascinating. We figured out how modern medicine can actually influence this system. So let's start with the rest and digest side, the parasympathetic players. First up, what if we need to give that rest and digest system a boost? Hit the gas? Well, for that, we use drugs that act like a gas pedal, either stimulating the system or just mimicking its effects.
The official term is parasympathomimetic. It's a bit of a mouthful, I know, but it just means it mimics the parasympathetic system. It's basically a copycat key that fits right into that rest and digest lock. And seeing this in action is pretty cool. Take a drug like Bethanacal. It's a muscarinic agonist, which just means it directly stimulates a specific type of rest and digest receptor. Doctors use it to help patients who have trouble with urinary retention after surgery. And hey, even nicotine fits in this category. It just activates a different set of receptors, which is why it can be used in smoking cessation therapies to help manage those cravings. Okay, so if we have a gas pedal, we've got to have a brake. What if we need to block those rest and digest signals? Well, for that, we turn to the parasympatholytics. These drugs are often called anti-muscarinics, and they do exactly what it sounds like. They go and sit in the receptor, the lock, and they just physically block the key from ever getting in. So the rest and digest message simply can't be received. And their usefulness is just incredible. By blocking the parasympathetic signals that can constrict airways, these drugs are absolutely crucial for treating conditions like COPD. They're also what we use to prevent motion sickness, to speed up a dangerously slow heart, or even just to dilate your pupils for a routine eye exam.
Now let's flip the coin and look at the other side, the sympathetic system. How do we influence the fight-or-flight response when we really need to?
You guessed it, we're starting with the gas pedal. These are the drugs that mimic or amp up that fight or flight response, kicking the whole body into high gear.
And the name for this class of drugs? Sympathomimetic. Just like before, that mimetic part tells you it mimics the sympathetic system, getting the body prepped for some kind of intense activity.
And these drugs are without a doubt absolute lifesavers. Epinephrine is the go-to for treating a severe allergic reaction, anaphylaxis, and for restarting the heart during a cardiac arrest. A less dramatic but way more common example is phenylephrine. That's the active ingredient in a ton of nasal decongestants, and it works just by constricting the blood vessels in your nose.
Okay, finally, let's talk about the brake for the fight-or-flight system. These are the drugs we need to block or at least tone down that high alert response, which is often really important for treating more chronic conditions.
We broadly call these adrenoceptor blockers, or sympatholytics. They work by blocking either the alpha or the beta receptors that are waiting for that fight or flight signal. You've probably heard of them before as alpha blockers or beta blockers.
Now, what's really crucial here is understanding that their effects and their side effects are two sides of the same coin. As the source material points out, A primary side effect is just a direct result of what the drug is designed to do. So if you block the signals that constrict blood vessels, alpha blockers can cause something called orthostatic hypotension. That's just the fancy name for that dizzy feeling you get when you stand up too fast. So what does this all add up to? When you put it all together, it means that medicine has figured out this incredible way to fine-tune our body's internal systems, all by understanding this one fundamental balance.
So if you zoom out, it's all pretty elegant. Your body's autopilot, the ANS, is in this constant dance between resting and fighting. And what we've done is create a toolkit with 4 basic tools. We have a gas pedal, or a mimetic, and we have a brake, or a lytic, and a blocker for each system. And having that level of control is what allows doctors to treat this incredible range of conditions, from asthma to high blood pressure, just by boosting or blocking our body's own natural autopilot signals.
And all of this leaves us with a really fascinating question. We've actually learned how to manipulate the very core of our involuntary functions. So, as our understanding gets even more precise, what new treatments, what new enhancements could become possible? What do you think is the next frontier for our body's autopilot?